It's Rise and Shine time. Welcome back. It's the Ability Connection Colorado podcast, Rise and Shine. My name is Jared, and all month long it's June is Scoliosis Awareness Month. So all month we are visiting with the survivors and the families of those children who were diagnosed with infantile or early onset scoliosis. And today we're going to talk to an orthopedic surgeon who met Dr. Mehta and begin using her Mehta Casting method to straighten the spines and save the lives, likely, of many children. So I look forward to this. I just want to mention to you that ISOP, the Infantile Scoliosis Outreach Program, is driven by your donations. And of all the places you might be thinking about donating to, this one has a direct line from your input, your help, and saving children's lives. You may have met some of them. If you haven't already, you could see all our podcasts at accopodcast.org, or just get comfortable as we talk to the wonderful Dr. Jacques D'Astous. And I am wondering, Doctor, I have this one question, and Heather, just interrupt and take over at any time. But there's this question that I've been wanting to know. Heather told me that with young Liv and her scoliosis, that she became a mother that doctors feared seeing. When they saw Heather, they knew they were about to get a ration of perhaps some motivation.
Yes, or grilling.
Right. Yeah.
Whichever way you want to look at it.
What is it that made you decide to listen?
Well, I guess one factor that made me listen is in 1998, we had Professor Jean Dubousset from Paris, who came over as a visiting professor. And at that time, he saw Olivia and Brianne, who are my first two patients from Colorado. And he came into the room and he just looked at them briefly, lifted them up by their head to assess the flexibility of the curve. And he said, of course, he says, these girls need casting. So I said, okay. And he said, well, you learned all about it when you came to see me, because I was a French traveling fellow also too. So I spent some time with him in Paris. And so that's where I learned casting, basically.
That is incredible. Heather's told me about that day. Do you want to revisit that at all, Heather?
Well, I was talking to Dr. D'Astous about it this morning. He did it so fast that Brianne's mom, Joyce, and we didn't even have time to react. Like he really knew what he was doing, Jean Dubousset. He came in, and what I really remember is that I had done some research in the basement at the Denver Public Library, because this was like pre-internet, and everything pointed to Dubousset. So I started sending her stuff to his hospital with nothing. He never replied. And then a doctor an orthopedic surgeon in Colorado, and I never drop names here, but she called me at home and said, has he contacted you back? And I said, no. And she said, I'll be willing to give you his home address, but you better promise never to ever tell anybody where you got his home address. So I sent Olivia's stuff to his house, and I even included a photo of her little infant passport. And I said, please contact me, because if not, we might just take a fly out there. Like, I'm desperate. Nobody in the United States will touch her. And then we had already seen Jacques, and then all of a sudden I get a call from Jacques, from the Shriners in Salt Lake City, inviting us to go out there. And Dr. D'Astous was the only one that would even touch Olivia. And it wasn't until I found Dr. D'Astous that anybody was going to do anything. Like, he literally gave me 18 years with Olivia.
Well, in many more years with many other children, Dr. D'Astous, we've been talking to other families, and they speak of you fondly. And it was this. And so you met Dr. Mehta.
Yes, I did, back when I was a fellow in England. But at that time, I don't think she had published her paper on the scoliosis. That was in 1977, I think. Mm-hmm. And I just met her briefly. So, but then I got to meet her again when she came to the workshop and came to visit Salt Lake City. So,
And then
Oh,
history is made, as at least in the parents I speak to, they found someone who listened and someone who wanted to take on this challenge. And did you work with Dr. Mehta together, you and her, to learn the casting method?
no, I had learned it from Dr. Dubousset and his associate back in 1998, I think, or sorry, 1997. Sorry, 1977 when I was a fellow out there. Yeah.
The 1900s, as my kids say, which just hurts, but sounds so long ago. How many children do you think you have casted? Do you know?
I think close to 100.
Like, we were talking to this family, uh, and the parents are two kids in college. They're working jobs, and they have this little girl, Charlie, and they're going back and forth from
Right.
Colorado to Salt Lake for this casting. And in the
Right.
beginning, it seems maybe a little medieval. The grandmother of the little girl talked about how she wasn't that active for the first few days, but then they gradually start to see the value.
Right.
How were you able to convince parents that this was the answer?
It was hard because with the cast, they can't go swimming, they can't do the normal activities, and you can't hug them. You don't have the parental feeling that you usually have. But I looked at other treatments, and at that time we looked at there were no rods, no growing rods or anything like that. And I think for the very young ones, the only way that I could see was to cast, and that's why I took it on. So.
And I don't want to walk you down some path where you have to disparage the medical community, but fusing a infant spine seems like a really bad idea.
It is a bad idea. It restricts lung growth quite a bit because before, one of our professors used to say it's better to be short and straight than short and crooked. And he wasn't taking into account the pulmonary alveoli and all that stuff at that time. And I think this way here we preserved the chest as best we could. And we also got the derotation and the molding. And so it was a good thing. But initially, we had the cast all in plaster, which doesn't last as long. And so we had a plaster base and then we did our molding with the plaster, and then we just overwrap with fiberglass after that to keep it more. And we even had one of our families create a wetsuit for one of their kids, and they would throw them off the diving board and stuff like that too. So it was pretty impressive.
That is impressive, and that's interesting because plaster, and maybe I'm getting this wrong, but it seems like plaster would have been outdated, and more people would want fiberglass. But the plaster is better.
Yes, yeah, it's better for the skin, and it's better for molding, and it's better all around. So, yeah.
Yeah, Heather. I'm gonna. Hopefully, I don't reveal too much. She was a little intimidated in trying to call you. She wasn't entirely sure if she should bother you, and I think we rallied around her to say that she should, because we all wanted to meet you and talk to you.
Yeah, so I don't know if there's anybody now in Salt Lake City that does any casting. So
it's heartbreaking to hear, Dr. D'Astous.
I know it was heartbreaking for me too to see the old shrine disappear. So they just have physical therapy and the outpatient clinics now, and all the surgeries done over at primaries.
Well, it seems like you and Heather were getting a lot of media about this. It seems like I've seen some clips. It seems like that there was some buzz that at least would have helped the medical community understand the importance of maintaining this.
Yes, and I traveled around quite a bit trying to give presentations, and I was at the DuPont Institute. I was in Dallas, as was Heather, and I went up to New Orleans, or down to New Orleans, I should say, and I gave the same talk over and over again. And I think I was able to convince quite a few people that casting was the answer at that time. So, because as I said, they didn't have the growing rods or other things, but I still think that it is the answer, because we ended up curing a lot of people at the time, the ones that were less rotation, and the ones that were young, 2 and under, we had a fairly high cure rate, which and The other option was the other option was to observe them, and all you would see with observation is see them get more crooked and more difficult to correct later on. So
I don't know if you do this, but if you happen to think about your legacy, is this a pretty big part of it?
I think it is. Yes, definitely.
We have several more people to talk to. Heather, have all these people been in contact with Dr. Stu?
Half of them, I
Yeah.
believe. I've got a couple from, most of them are Shriners patients. Like, I think there's one from Chicago, one from South Carolina, a couple, maybe one or two from Florida.
Right.
But the older ones are Jacques patients, and that's really what I wanted to showcase here. Long term, and how they're doing as young, or as how they're doing as 18-year-olds and in their 20s. They're
Right.
still straight and they're still living, wonderful lives. So
Yeah, we've talked to star volleyball player, national champion cheerleader. These are two young girls that I don't know if would have had that chance without the process with Mehta Casting.
I know. And there's another one who's a great violin. Well, Brianne, I think, is a very good violinist also too. So, and yeah, I've been very proud, and one of them actually got their PhD not too long ago with the graduation ceremonies, and that's how long I've been doing it. So, so they were just little infants at the time. So,
do doctors ever retire? Is that really a thing, or?
well, I was forced to retire because I had several strokes, unfortunately.
Okay.
So, I was my chief of staff basically said, you can't operate. So I retired back in 1977, I think, or 2017. Sorry.
But here you are now, and with your mind, which seems still very sharp.
Right.
Yeah. Are you going to continue to publish or endorse anything? Is that something you're able to do?
I'm not going to continue to publish, but I'd be happy in endorsing the Mehta technique of casting, and because I still don't think that they found anything better for the young patients that got all straight, with the casting. So, but unfortunately, my other PA is now in Boise, and he's retired also too. So he's no longer doing. And as I say, we don't have access to the operating room, except for doing what they call real surgeries, which is open surgery. So, and I don't think that's necessarily the first way to go in kids with scoliosis.
You should be careful in saying this, because Heather will steal you away in the night and drive you around the country in a Winnebago.
Yeah.
Yeah. But I know you've done a lot already. Heather, you've told me so much about Dr. D'Astous. What would you like to tell him that you already haven't?
Well, we talked a little bit this morning, so I just want to reiterate to Jacques that I really don't think that I don't think that EDF, specialized Mehta casting, would be to where it is today, standard of care in the United States, without him. If he wouldn't have allowed us to bring him in that first time, and if he wasn't a true believer, I just think it would have stopped dead in its tracks. I think that Dr. D'Astous is everything to this movement, and I just, words aren't enough, Dr. D'Astous. You've helped so many kids. I just want you to know, so many of them you will never see, you will never meet, but I talk to their parents all the time, and it's going to keep going. It's going to keep going if we have anything to say about it. And that's why I think it's really important to solidify treatment principles. Like,
Right.
some of the things that I see today, it just doesn't have to be that way.
Right.
I think, you had just mentioned, and I'm glad you brought it up. Back when Dr. Mehta came to Salt Lake City for the first time, You know, of course, the casts were plaster. We all seem to agree, you know, not only the medical professionals, which I'm not, but I'm a parent that's had pretty much every single cast known to mankind applied to her child. So I know cast types and I know badly applied casts and good applied casts, and I know the difference between materials. And I think just this basic stuff, if we could nail this down, it's going to be important to maintain the integrity of all of this work, Dr. D'Astous. Like,
Right.
we spend a lot of time, or I spend a lot of time talking to parents who are in the emergency room because they know that pure fiberglass casting is not faring their child well. You
Right.
know, so just even within the last month and a half, we've had two pure fiberglass casts removed in the emergency room. These young patients wore these pure fiberglass casts for what, 4 days. The casts were removed, and you know, I'm sure you can imagine what some of the skin issues look like. One of them literally looked like a stab wound. Like, these fiberglass wounds, they happen fast and they go deep. And in many cases, they're before the parent even notices what is happening. You know, that we got to get it taken off in the emergency room, and the wound is so bad that it delays the next cast in their series. And I'm just continually seeing this. I mean, we all want our children to be able to swim. I guess what I'm saying is it would be, you know, first of all, plaster Paris is the preferred material.
Right.
Any master caster that I've ever spoken to with experience is in agreement with this.
It's unsurpassed in moldability, number one, and number two, it's very gentle on the skin. Although we have had a few pressure sores, but very few in the 100 or so cases that I treated.
Right. I mean, I've been in this for a long time too, Jacques. Certainly not as, you know, long as you, but I've seen what fiberglass can do, and fast. It should not be the first material used for Mehta casting.
No, no, I agree with that for sure because and they're also using fiberglass for fractures and all sorts of other stuff. And I think that's a good use of fiberglass. But I think for the Mehta casting, it's the best to go start with and finish with plaster underneath and fiberglass on top, just to make it last longer.
Yep.
Dr. D'Astous, we have a lot of parents on here, and the one thing they've learned in the process that was very valuable for them was advocating for themselves.
Right.
Do you have any insight or advice for patients and how they should advocate or communicate to talk to a doctor?
Well, I think uh, the Mehta casting is harder on the parent than it is on the child. It's incredibly well tolerated in children, but it's the parents that have a really tough time accepting it. But once you get them on board and they see, oh, well, you know, because we have pictures of kids doing somersaults in the gym and doing all sorts of stuff.
I I just want to say something too. You know, I agree 100%. It's harder on the parents. Um, but when it can be harder on the patient is when they have a badly applied pure fiberglass cast.
Yes.
That's why I really need to nail down these treatment principles. So, um,
Sorry. Keep going. Sorry.
I was just going to say that's like my big goal this year. I want to nail down these treatment principles once and for all, just basic stuff. Why plaster is better to start out with.
And I think it's important for me, anyways, to go over the shoulder and because it keeps your head on top of your spine and everything, and it keeps it balanced so you don't fall off to one side or the other. And if you start with an underarm brace or underarm cast, especially made out of fiberglass, they can fall off the top and stuff like that. It's just, to me, it's not as good. And I've never done that. So, but I must say that we had very few chest wall deformities, although we did have a couple of them. But it's also important to carve out a large abdominal window and on the contralateral side to have a posterior window where not where the rib hump is, where the concavity is, so that the spine can derotate at the same time.
So that's it. I'm so glad you brought that up, Dr. D'Astous. I'm always getting asked that question, and that's pretty much the way I describe it. D-shaped window on the concavity side. Not only does it allow the ribs on the concavity side to grow out of that hole with every breath, but it also molds down the ribs on the convex side. So with every breath, that derotation it's happening just a little bit if it's done properly. Am I right?
Yes, I think so. And again, with plaster, we do put pressure. We put felt underneath, and then we put pressure on the apex of the curve, and then we try to push it as much as we can. And we do it's called EDF because elongation, which is important under traction. We do a derotation maneuver, which is pushing the rib hump back, or the curve back over to where it should be. And then the F is for flexion, and we flex the hips a little bit so they can walk and stuff like that.
Isn't that an issue with pure fiberglass casting? Like you attain flexion at the very end of the process, am I right? And
Yeah.
by the time it's time to provide flexion to that cast, in many cases it's almost impossible because the fiberglass is so rigid. Am I off in saying that?
No, because the plaster, we can use what we call duck bills, and we can, make larger windows or open up the windows in the chest and at the hips.
Heather, you might already have these, and Dr. D'Astous, perhaps certainly you, but what are there a certain number of principles that should guide people in their care and treating their child?
Well, number one, I think traction is very important. So we used to put traction on their necks and head, and then counter traction on the iliac crest with Webrel, and we pull down, and they would be stretched out because traction is one of the things, and that's what Dr. Dubuisset did when he lifted them up. You assess the flexibility and stuff like that. So that's one important thing. The other important thing is to use plaster underneath, because it's the most moldable system that we have, and the most moldable substance that we have. And then after that, we just put fiberglass on top to make sure that the cast stays in one position. And then we put elastoplast, or not elastoplast, but a tensor bandage around that, so the fiberglass would bond to the plaster underneath. So I think those are the main principles. And we always went over the shoulder on both sides. So, because I think that if you do this, you can fall off the top. And in some cases, actually, we went to occipular mandibular extensions when they have very high curves to try to prevent them from progressing.
And would you add into those principles the holes you were talking about in the casting? The kind of
yes, definitely. Windows are very important.
Mm-hmm.
Yeah, otherwise they can't breathe. So.
Yeah, that is important. Yeah. Well, that's something I've learned in working with Heather and talking to other people within the scoliosis community is the difficulty in breaking into medical convention. I mean, you have journals and that you want to be in, and doctors you want to convince. Even insurance won't let you bill if you don't exist in certain coding
Right.
doctrine. What I guess how are you convinced about something new that comes to the medical community? What number of things must you see?
I prefer to try them and see that it works in my own hands, number one. And then I've never one to give over to the equipment salesman or whatever. It's not always the latest and the fanciest thing. And I think that is a big problem with Mehta Casting, is it uses very old-fashioned techniques. And in one of my talks, I compared it to the Prince and the Popper, because the Prince obviously is rods and stuff like that, but the Popper is casting, and not only are the materials not expensive, but the reimbursement for that is not very good either too. So that's what I think probably makes a lot of physicians not accept that casting. They'd rather put rods in and stuff like that. So.
this suspicious, not very well immersed popper in their office is not something that gets their attention.
No.
Yeah.
What do you think about the newest, latest EDF brace that's making great claims? I'm having, new parents get on my group with these, these braces that actually have been around for a while now. It's not like they're new. They claim that they're EDF, but when it really comes down to it, it's just a removable brace.
Right.
And I've got new parents coming on the group that have never experienced a cast
Right.
ever, but they feel comfortable enough to come on and say how inhumane casting is.
I think that the brace that you're referring to was just coming into style when I retired, unfortunately. Mm-hmm. And I knew it was, for a while, it seemed to be very popular. And they weren't doing the computer assisted designs at that time. But I think there's no replacement, I think, in my mind, for the hands who know what they're doing and just, putting everything as straight as you can. And because that's the other thing is we always got an x-ray in the cast standing up afterwards, and just to see how much correction we'd achieved. And sometimes we were very happy with it. And other times we say, well, we'll wait till the next cast and we'll see if we get more correction at that time. So it was very difficult from that point of view.
My advice to these parents now is to have these rotational phase discussions with these doctors that are claiming that this removable brace is going to cure their child's rotated and rapidly progressive curve. Yeah. So, I know these conversations are difficult, but they really need to nail these doctors down on what rotational phase their baby's spine is in before they discount this effective treatment we've been,
Well, I think it's a lot easier to prescribe a brace than to apply an EDF cast. And I think that's where a lot of modern surgeons are going to, nowadays. So
there is some tendency for simplicity over success?
Yes, unfortunately. Yeah, it's simplicity over success is a very good word of putting it also too. So.
Mm-hmm. Okay, so let's see. I wanted you to talk to me about the removable EDF braces and all that nonsense. And I'm glad we got to touch base a little bit on the underarm versus over the shoulder. I think it's really important for new parents to understand, the necessity and the effectiveness that these over the shoulder casts can have.
I think it would be important too, and it is very important. And like you say, you can't fuse them when they're very young because you are interfering with the chest volume, which is a big thing nowadays. And then, and that's why the Vector and all of these other instrumentations came out. And I have nothing against those other techniques, but I think at first I would certainly try, if it was my own child, I certainly would try casting first.
Mm-hmm. Oh, Dr. D'Astous, Jacques, I'm just so glad to see you. And I'm so glad that things that I say on my group and things, I've always got to make sure that I'm giving the right information. It's been my main goal in life. And I'm not a doctor. I don't want to mislead these parents, so I really need this dialogue from you. And I'm so grateful for it.
But I also appreciate all of your hard work, Heather.
Thank you, Dr. D'Astous.
I'm wondering, Dr. D'Astous, when you were becoming a doctor and you had some maybe high ideals, you had some goals, and now you look back, did you fulfill them?
I think I did. And certainly I wasn't as involved in scoliosis when I was in Canada for almost 20 years. And then I came down here, and through Heather and Dr. Dubuisset, we started casting. And I have no regrets of that. And I certainly, with all my visiting professorships and all this stuff, I was more well known as the casting man in town, so or the casting man in the U.S. So
Yeah, Casting Central. That's
yeah,
already taken in Hollywood, but it
right,
could be you.
Well,
And,
I remember when Dr. Min Mehta was invited to speak at Oxford, and that doctor there invited me to accompany her.
right.
So I had to do that speech, and it was the scariest thing in my whole life ever.
Right.
And, but when we were out there, oh my gosh, now I lost my train of thought. Hold on.
okay, scariest speech of your life, scariest moment. That's where you were
In England.
Yeah, now I can't remember.
Uh,
But oh, okay, now I remember. Yes, when I was putting together that presentation, I remember talking to you about it, Jacques, and I remember saying it was before I put together the presentation, and we had a conversation, and you made me understand that, these doctors go to school for a long time, and
Right.
I can't expect to change their career midstream to
Right.
become cast techs. Like,
Right.
you taught me so much, Jacques.
Yeah, it's unfortunately that's the way it is. It's unfortunate, and most surgeons are taught to operate number one, and in the operating rooms they want to make their money on that also too. And casting for the operating room is a very negative thing because they're losing money. In fact,
Yes. And that's why all of these master casters must be held in such high regard, Jacques, and I say it on my group every day, 10 times a day, because I want the parents to understand that if you're getting a good cast now, stay there. I mean, because these doctors are literally getting a big chunk taken out of their practice by doing the right thing.
right,
Nobody's getting reimbursed properly.
right.
They're doing this because they know it's the right thing for these young patients. So
And
I
yeah,
try to explain this to my families because I get it. I want them to get it too.
and are the fiberglass casts they're done in the clinic usually too? Are they?
No, they're actually, these new hospitals are actually anesthetizing these
Okay,
kids and dropping them on some Jackson frames are modified,
right,
some Spica frames are modified, some are not. I just don't know what's going on out there in the wild, wild west. But I do know that it's time that these hospitals that tout that they're applying Mehta casts, it's time that they get the right equipment. They shouldn't these kids shouldn't be casted on Spica frames and
right.
adult blah blah blah. Like, I've kept the cost of the equipment so low, Jacques. Like, I got in this for the right reasons. I just want to see
Right.
these kids casted.
I'm wondering, Dr. D'Astous, on this 20th anniversary of Dr. Mehta, I think coming to Salt Lake, what your memories of her are.
Uh, I guess the first memory is she was a very tiny woman, um, and very quiet and very polite. And then I remember going up with her to Park City, and I've got a picture of her beside a moose in Park City. And we had a reservoir right at the very top before you go down into Park City, who has a reservoir. And I have a picture of her in front of the reservoir also too. But it was a great visit. And then probably one of the other things that I remember is we came back down from Park City, and then we were going to go for a beer, and she was insulted that we weren't inviting her for a beer also. So she came along for the beer also. That was really nice.
Oh, good for her. So
Oh,
small, quiet people are also very powerful.
That's right. Yeah.
oh, our little mini men. I just love you both so much, Dr. D'Astous. What you've done, I can't say enough.
Oh,
So
that's
thank
good.
you. Thank you for Liv. Thank you for all of it.
Oh, you're so welcome.
And when I promise, like, I want to drive to Nevada here, within the next few months. And when I do, please let me visit you.
That'd be great.
I must meet your wife, and we just need to sit down and have a beer.
And I look forward to your visit.
Awesome. I can't wait.